Welcome again. In this short presentation, we will talk about duplication cysts. Duplication cysts are submucosal lesions. Submucosal lesions. The definition of submucosal lesion, as we all know, is bulge of the GI lesions within the esophagus, stomach, or rectum, or large or small bowel. Totally covered by normal mucosa. So it is not a mucosal lesion, it is a submucosal lesion. It may arise from the third layer in the submucosa, or even it may arise from outside the gastric wall but very adjacent to it and indenting it. So it may occur in the wall or just outside the wall. This is the endoscopic picture of the duplication cyst. Here, this is what is proved later as duplication cyst in between the bulb and the beginning of the second part of the duodenum. It is a mucosal bulge, very clear, totally covered by normal mucosa. And of course, the differential diagnosis is all submucosal lesions as leiomyoma, as GIST tumor, as lipoma, and so on. This is the endosonographic picture of the same lesion of the duplication cyst. So when we apply sonographic waves, we find that it is at anechoic black, jet black lesion with posterior enhancement, definite posterior enhancement, and the hallmark of the duplication cyst is the multiple wall or double wall. You notice here that is multiple layers. Here, this duplication cyst is located in the submucosa. It is an echoic posterior enhancement and no color flow signal whatsoever. This color flow signal, is outside the duplication cyst, but the cyst is totally anechoic. But sometimes it is mistaken for leiomyoma, especially leiomyoma, because leiomyoma is a vascular tumor, dense hypoechoic. GIST is maybe somewhat heterogeneous, somewhat have some vascularities, but leiomyoma really looks like a duplication cyst, but here the duplication cyst has a posterior enhancement, so pointing to its fluid phase. This is the duplication. This is highly impressive of a duplication cyst originating from the submucosal lesion, and this is the muscularis propria layer, so it is located in the submucosa. Okay, so the hallmark of the duplication cyst is the double layers. You know that it looks like a gut wall. When you see these layers of the cyst, this cyst is outside the wall. This is the gut wall and this is outside. This is a type of duplication cyst which is located outside the wall, just outside the wall, very near to it, adjacent to it, indenting it, and have a wall layer like the gut. If you notice, this is the gut wall of the second part of the duodenum, and this is the wall of the duplication cyst. It's multiple than one layer. It is about 1, 2, 3, 4, 5 layers. Its wall is like the 5 layers of the normal gut. So this is a classic duplication cyst. It is just outside the wall, but has 5 wall layers like that of the gut, anywhere from the esophagus to the rectum. This is a duplication cyst, but for differential diagnosis. When I see this cyst, yes, appears that it originating from the second layer muscularis propria or third layer submucosa. Very difficult to tell, but what is sure that it is not originating from the muscularis propria layer. This is the muscularis propria layer, very nicely seen. It is inner to the muscularis propria layer. If you consider this the submucosa, then this will be the muscularis propria. Will be in the muscularis mucosa. This is the muscularis propria. Yes. And this is inner to the muscularis propria, so it may be located in the submucosa or the muscularis mucosa. So the differential diagnosis here is duplication cyst or leiomyoma, a small leiomyoma. It is sometimes very difficult to differentiate because both may be located in the second layer, which is the muscularis mucosa layer. Both are anechoic, no color flow signal inside because leiomyoma is very hypovascular. Both are black because both are hypoechoic, so somewhat difficult to differentiate. But I think, and it's finally proved to do duplication cysts due to the presence of posterior enhancement. This rectangle behind the lesion is rather hyperechoic, more whitish than the adjacent areas. So this rectangle of hyperechogenicity is posterior enhancement favoring the possibility of duplication cysts. If you do FNA, the duplication, but do it by 19G needle because somewhat the fluid is very thick. If you do it by 19 needle, in duplication cyst there will be a thick fluid, mucoid fluid. But if it is leiomyoma, it will be a bloody aspirate. Okay, very nice. Seen, the muscularis propria is intact. And it is anechoic, no color flow signal inside. But finally, this proved to be duplication cyst. And this is another example of duplication cyst, which may be mistaken for leiomyoma. And finally, this is the FNA. It is a mucoid material in the duplication cyst. Typically, it is a mucoid material giving positive string sign for more than 5 millimeter. And in the cytopathology, it stains positive for mucin by Alcian blue or periodic acid Schiff diastase or mucicarmine. So classically, the fluid inside is very thick, very viscid, mucoid, and stains positive for mucin. And thank you very much.